Bismillah ar-Rahman ar-Rahim, my dear candidate for MRCS. I always would like to have a channel between candidate going for MRCS exam and one of the examiners of the Royal College. You can ask the questions and to get the answer, I am sure you will have a lot of questions. And to create this channel, very easy. To send your question, you just to go to my YouTube channel. And then if you have any of my videos, and you put a comment, I will get it here in the community tab. So community tab will give me all the comment that I have on any videos. And I will either reply to you in the form of reply as a text, or even maybe make a video on this topic in order to answer your question, because I think all your questions are very important for you to help you to prepare for the exam. So here is the last question that I have received about 18 minutes ago. It's someone called MRCS candidate. He told me, "Good morning, Mr. Muhammad. Can I have an actor with no physical positive finding in MRCS examination, like hand examination, which is normal, or ankle examination, which is normal after I examine the patient?" Thank you very much. This is a very important question because in the exam, we get an actor. We do not get real patient. So when you get someone for hand examination, knee examination, ankle examination, they do not have a pathology, but they have an actor instruction to imitate one of the diseases that you should easily discover by your clinical examination. So you will not get an actor which say everything is okay. It doesn't have a pain. All the signs are normal, because the exam does not want to trick you. So give an example. For example, hand examination. We can bring carpal tunnel syndrome. We can bring radial artery palsy, ulnar artery palsy. And in this situation, the actor have an instruction. If you touch a certain area of the hand, he will say, "I don't feel this." When you test the motor power in certain situation, it will show you weakness. If you start to do tapping test, it will give you the positive sign. So some of the candidates, when I examine them after they examine the hand, they say everything is normal. Be sure if you say this, you did not pick up the physical sign of the patient, and usually you fail this station. So, for example, in the ankle station, there is always pain on certain movement of the ankle, either inversion or eversion. And whenever the patient walk, he will imitate to you antalgic gait. And he will give you very good scenario with sensory loss, will give you good scenario about pain on certain movement of a joint, and will give you even positive signs, like, for example, Trendelenburg test. It will become positive by the actor as well. Same for the knee examination. There is an instruction for the knee examination to show you either there is pain when you do valgus or varus stress test. You will not have pathology like hot temperature. So when you feel for temperature, feel quickly for temperature. No need to put your hand every 3 centimeters feeling for hotness, because I will not get you an acute arthritis patient with an acute pain. It will be unhuman to be examined by 40 doctors on the day. So please, regarding swelling, you will not see swellings. Even when we get parotid gland examination, in the scenario, we will say patient have a swelling in that area for 2 months duration, but it has disappeared yesterday. So you examine this patient, then you don't say, I feel swelling 2 by 2 centimeter in diameter, because here you are imagining. I want you to give me the physical sign. So to answer this question, can I have an actor with no physical sign? I will get the reply. Thank you for your question. You could never have an actor with no signs at all, either pain on movement or loss of sensation or positive, for example, positive tapping test. So always recheck your examination before saying no physical signs, because you will be mistaken. So this is an important question. I will send it to the doctor as a reply, and you can see you can have the reply as soon as possible to all your questions. And you can send me the questions anytime, and all your questions will be answered within probably 48 hours. And you can put it in a comment of any of your videos. I hope with this I have created a channel that you can ask an examiner, and the examiner will come back to you with his reply. I hope it is useful. I hope it will help you to pass the exam, and I hope all the videos I am making is of benefit to all candidates to pass their exam easily. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon and the examiner of the Royal College of Surgeons of England. And I wish you all the best.